Hi everyone, welcome to your channel I Love Pharmacology. In this session, let us learn about a very important topic you must learn. Please remember, this is a topic of importance for everyone who is watching this video. So please remember, pharmacological antagonist is one of the topic that has been asked many times in your exams. You should not miss this topic. So let us start. What is pharmacological antagonist? So antagonist means there is some drug which produces the opposite response, which will going to oppose the action of the other by acting on the receptor. So pharmacological means they are the drugs. So whereas physiological antagonism, you can go and watch my video on physiological antagonism, which I have made separately to understand the physiological antagonism, which are also called as functional antagonism. So here in pharmacological antagonism, you involve two drugs, whereas in the physiological antagonism, there is a drug and there is one more a physiological agonist. So here completely the pharmacological antagonist will have two drugs in particular. So let's see what is pharmacological antagonist. So here also similar to that of physiological antagonist, there is a two drugs which acts in a two opposite direction. There is a two opposite responses, but they act on the same receptors. But whereas in the physiological antagonism, they were acting on the different receptor sites on a single system. So this is the main difference between the physiological antagonism and the pharmacological antagonism. So let us understand again. Physiological antagonism means the two drug will act to produce two different responses, but they are acting at the two different sites on the same system. Whereas in the pharmacological antagonism, two drugs acts to produce two opposite responses, but they are acting on the same receptors on the single system. So let's understand. So example, let's take a example of propranolol, which is a non-selective beta blocker. So what is the effect on heart rate? The propranolol will block the beta 1 receptor in the heart to produce a reduction in the heart rate. So there is a decrease in the heart rate by a propranolol. So if a similar kind of drug has to act on the beta 1 receptor, it should have opposite response. Means there should be a drug which will going to increase the heart rate by acting on the beta 1. So the example will be your adrenaline. So adrenaline, by acting on beta 1 receptor, it will going to increase the heart rate. So adrenaline is a beta 1 agonist. So adrenaline acts on the beta 1. Its action is beta 1 agonist. So it stimulates the beta 1 receptor in the heart to increase the heart rate. Propranolol will going to block the beta 1 receptor in the heart to decrease the heart rate. So beta 1 is particularly found in the heart, please remember, and beta 1 receptors will be blocked by propranolol, which is a beta blocker, to cause a bradycardia. Bradycardia is nothing but it is a decrease in the heart rate. So again, the adrenaline will act on beta 1 receptor, but it has got agonistic activity, and action of adrenaline on beta 1 receptor will cause tachycardia. So this is the example for pharmacological antagonist. So here the propranolol is a pharmacological antagonist of adrenaline. So this was all about the uh, today's topic on pharmacological antagonist. If you find this video, please do subscribe to my channel I Love Pharmacology for more updates on pharmacology. And again, once again, please do watch my video on physiological antagonism, and if you go through it, you're going to have a clear cut idea as well as understanding on the physiological antagonism as well as pharmacological antagonism, which you're going to forget in your lifetime. So you're not going to forget anything if you go through this simple slides. Thank you.